Hello, welcome to our second question and answer session on vaccination and the Trust's response to that. Following our successful webinar on the 15th of January, which is still there for people to look at and where we've answered a lot of questions, we've invited all our staff to send us in more questions, and we've gathered those up, and we're hoping to be able to answer most of those today. If there are any questions that are still unanswered and that you'd like us to respond to, please keep sending them in, and we'll do our best to give you a response to those. Okay, today we have for our Q&A session Dr. Giovanni Sutta, who is our infection control doctor for East London and a consultant for infectious diseases at UCL London. Also, Dr. Ben Braithwaite, clinical director for community health in Newark. Welcome both. Okay, so we're going to start with some questions to you, Ben, first, if that's all right. Mm-hmm. So the first question we've had is, will the vaccines be available for people who don't have recourse to public funds?
That's a good question, and we know that there's a lot of sort of worry for people who, for various reasons, aren't allowed to access kind of routine NHS care. There's been lots about sort of charging for NHS services in the past. Certainly, we know for actual testing and treatment for COVID, those rules have been lifted, so anyone can access testing and treatment for COVID. For our staff, for ELFT staff, then we're not making any checks on people's kind of wider NHS eligibility, so that won't be a factor. Everyone working for ELFT will be eligible to get the vaccine. For members of the public, for patients, the situation is still a little unclear. The rules haven't been exactly clarified, but the expectation is that on the same lines as it's in everyone's interest for people to be able to access testing and treatment, that same applies to vaccination as well. So I'd be very surprised if people weren't eligible, who would otherwise be eligible, wouldn't be able to access it because of that reason. But certainly all ELFT staff will be able to access the vaccine with no problem.
Thanks, Ben. And I think that answers one other question we've had, which is about once all patient-facing staff have been vaccinated, what about the rest of our staff? I think you're saying that everyone can come forward, is invited to receive the vaccine now. Is that right?
Yes, our intention is for all ELFT staff who want the vaccine to be able to have it. That also includes bank staff, staff who are working with us on agency contracts, and also people who are in need of the vaccine who are working for our contractors. So people like our cleaning and catering colleagues will be able to access the vaccination through ELFT if they wish to.
Thanks, that's great. Next question is, if I've had my first dose at Westfield, do I need to have the second dose there as well? And related to that, will I be sent a date for my second dose if I haven't received that yet?
It's a good question. So the main issue with your second dose is making sure it's the same vaccine from the same manufacturer as the first dose. We don't have any kind of real evidence yet about whether it's effective to mix the vaccines. And so that's the best reason to go back to where you had your first vaccine. The intention is for everyone to be able to get their second vaccine at the place they got their first. That's not compulsory though, so if your circumstances have changed or if it ends up being more convenient to have it somewhere else, that's fine. We can see from the national recording system which vaccine you've had and when, so there won't be any problems with your eligibility. But for most people, it'll probably make sense to have it at the same place that you've had before. The arrangements for inviting people for their second dose are still a little bit, let's say, flexible, unknown, because, and I'm sure people will have seen in the press about issues around just sort of delivery and availability of the vaccines. And because there's that extended sort of period between the first and the second vaccine, it's difficult for us to be able to predict a month or 2 or 3 in advance which days and where we're going to have suitable stocks of the vaccine to invite people in. So we don't want to book people for a particular day and then have to cancel them because the delivery hasn't come or there's some other issue. But the vaccine kind of programme, there's lots of working groups across the Trust looking at all of these aspects of the practicalities of the vaccination, and scheduling and inviting people for the second dose is definitely part of that. So if you haven't had another date booked at the time of the first vaccination, you'll definitely be told when you'll be able to book for the second vaccine.
Thank you. Okay, our next question is about people who've been shielding, they're asking really, as we don't know how long protection will last because it's a new vaccine, we don't exactly know yet, where does ELFT stand for those vulnerable staff who've been shielding once they're vaccinated? Will they be expected to return to work fully?
That's a really good question, and again it's one that perhaps isn't possible fully to answer at the moment in terms of the degree of protection and how safe it will be for individuals who've been vaccinated. What we are understanding, what we're assuming, is that it will depend more on the vaccine's effect on community transmission and the prevalence of COVID infection in the community, and so that it'll be those kinds of numbers that will determine when shielding and all of those other kind of protective arrangements will come to an end. Certainly the trust isn't going to force people to come back to work if it's not safe, and that's the whole point of shielding at the moment, is to keep people who are vulnerable for reasons of their health safe. And it's not likely that vaccination status alone will mean that you will not be allowed to shield anymore. It'll be more because you'll be allowed to come back to work or encouraged to come back to work when everyone is encouraged to come back to work because it's safer.
Thanks. And in relation to that, someone's asked, should we continue with lateral flow testing once we've been vaccinated?
Yeah, another good question. And the answer at the moment is yes. So although vaccination, we know, is a part of the solution to the whole pandemic, on an individual person basis, it's still not clear, and it won't be clear until lots of people have been vaccinated, exactly how much it protects both against illness, and we know that the vaccines protect us against getting sick and needing to go to hospital. We don't yet know how much it protects us against getting infected at all, and exactly what effect it has on our infectivity to other people. So it's still really important that we are keeping an eye out for suggestive symptoms and getting the PCR test if we have symptoms. And for those staff who have the Innova lateral flow testing kits, to keep using those twice a week so we can identify people who might have COVID that slipped in before we got vaccinated, or that slipped into that kind of 10% or so gap in the effectiveness of the vaccine.
That's helpful, thank you. Another question that's come up is to do with the fact that the vaccine isn't compulsory. We don't make everybody have it. And there's some questions, someone's asked about this could put other staff and service users at risk, and how are we managing that? Do you have any thoughts about that?
Yeah, I mean, it's a question for us as an organisation, and I suppose just more widely as a society, that vaccination is one of those things where we only benefit when everyone kind of does the right thing, and so we all benefit from each other's activity. There is a worry, I suppose, that people might try and free ride and get the benefits of vaccination without having to have the jab themselves. I'm sure, I hope that that doesn't include many of our colleagues, all of whom are in the caring professions. We all want to do right for our colleagues and for our patients. The vaccine isn't compulsory. There's nothing to suggest that either ELFT or kind of the NHS or the government more widely are going to make it compulsory. And that's the case with pretty much every vaccination, that there's always going to be an element of personal choice. There are always going to be people who can't have the vaccine for a number of reasons. And just like, I suppose, flu vaccination every year, even though the trust has a direct kind of financial penalty that it pays if we don't get enough people vaccinated against the flu, we haven't kind of made it compulsory. We encourage people and we make it as easy as possible, but there's no compulsion there. Our hope is that kind of information and information sharing like this will help to reassure people enough of the safety and effectiveness of the vaccine that they will be happy to do it without being forced to. Thanks,
Ben. Giovanni, can I ask you a couple of questions now that have come up from some of our staff about the impact of the vaccine on fertility and breastfeeding?
Thanks, Ravi. And I mean, it's a reasonable question. And as Ben was saying, is part also of the safety check that they have done for the virus before actually approving it. And we should all remember the vaccine now has been approved in different countries and independently by all different organizations in Britain, in Europe, in the United States, and so on. So before actually giving vaccine to any human, you always have to actually check it, for example, on simple cells, for example, like cell lines, and also on animals, like, for example, mice. and then actually you can see if there is actually an effect on fertility, for example, on those cells, because those cells and also those animals are actually much more susceptible to any changes. For example, if the vaccine eventually would have any change in the fertility. So far there is absolutely no evidence that actually the vaccine has got any effect on the fertility, and that is also why all the international bodies, they were absolutely happy to approve all the different vaccines as safe. And the same is the count also for breastfeeding. Absolutely.
Thank you. That's really clear. Thank you. The second question refers to when you can have the vaccine if you've had COVID. How long do you have to wait afterwards? What's the interval really?
Yeah, that is a very reasonable question. It can be quite confusing. So there are also international guidelines on this, for example, from the CDC United States, where they suggest that you can have your COVID vaccine after at least 4 weeks from your original infection. Let's say you had COVID, for example, 1 or 2 months ago. You can actually have the COVID vaccine after 4 weeks. Ideally, they also suggest maybe you should have then the vaccine between 3 to 6 months, and ideally within 3 months. And that is because they are also taking into account that potentially you may lose your natural antibodies, and then the vaccine will provide as a sort of booster. So you will actually be protected continuously. So it's a very common question, considering a lot of people already had, unfortunately, COVID, but it's generally after 4 weeks and ideally before 3 months.
Okay, thank you. That's helpful. Someone's asked, if I have a vaccination and I'm living with someone who's shielding, do I pose a risk to them?
Yeah, I can understand where this is coming from, because there are some other vaccines that are not COVID related, that are, for example, inactivated viruses or other things. So in those cases, potentially those vaccines are contraindicated, for example, immunocompromised patients. Let's say that this is not the case for COVID vaccines, because the COVID vaccines are generally or protein or genetic material, so there is absolutely no risk for immunocompromised patients that they live with you. So, or we call them vulnerable patients that they are living with you. So absolutely no risk at all.
Thank you. Thank you. Next question is about the potential negative long-term effects of the vaccine. So could you get it? Could it make you more vulnerable to another disease later in life? That kind of thing.
There is, I have to admit, there is no evidence so far to suggest any of this. And we should remember that, for example, the Oxford vaccine has been used before for other diseases, like, for example, malaria, and that has been used before like years ago. So if, for example, the Oxford vaccine was going to have, like, for example, the same material and method, the technology used was going to have, for example, any effect on long term, we should be aware by now. So I would say, I'm afraid there is no evidence at all.
That's reassuring. Thank you. The next question is about the contents of the vaccine themselves. So some people have asked, are there any animal or human products in the vaccine? Is it halal? And also, are there any traces of mercury or aluminium in the vaccine?
So let's start with the first one. So there are no animal or human products, because the vaccines are actually very simple. Okay, for example, the Phizerr vaccine is a simple RNA genetic material that is pretty much coated with lipids. So simple as that. Okay, so I can understand the question about mercury or aluminium, because those products are actually authorized by the Food and Drug Administration in the United States as a sort of adjuvant molecule that you can add to your vaccine to boost your immune response. And in the past, they've been used in some vaccine. And again, in the past and over the years, we didn't see any safety concern at all. Said that, all COVID vaccines, they don't contain any mercury or aluminium.
Okay, that's clear. Thank you. The next question is about the longer-term lasting effects of the vaccine. Will we have to have a new vaccine every year like the flu jab? I mean, I think a lot of people have been hearing about mutations and so forth, so there's a lot of concern out there about that.
And again, is a question that we will get more and more evidence with time. The really exciting news that we're actually getting, for example, from the groups in UK, is that the immunity from the vaccine seems to last for at least more than 6 months. That is very good. So, and of course, because the vaccine are so new, we don't know yet how long they are going to last, because only time will tell us. I have to admit, it may be possible that if we see that we lose our protection after 1 or 2 years, we may need another booster, as we do, for example, for influenza every year, but is not known yet. But is possible.
Okay, thank you. And someone's asked, why are we using Astrazeneca for our staff when the protection level is 62%, or is advertised as 62% for that? I mean, I know it's not only Astrazeneca, but we are using that for a lot of our staff.
Yeah, so let's start with the protection that the different vaccines they confer, and then also with the practicalities of giving the vaccines, because they are incredibly different between, for example, Phizerr and the Oxford one. So in terms of protection, so it is true that in the original study from Oxford, the protection from the Oxford vaccine, if you were given 2 full doses, was around 62%. Okay, and then there were also other people that they had a different dosing schedule, in which some of them they were given, for example, a different dose, and the protection was actually higher. Okay, so you will see inevitably different data. Say that 62% is very good if you consider, for example, if you compare with influenza, where the influenza vaccine that we get every year is generally around 50–55%, so no more than that, and is still very effective in preventing transmission of influenza among the wider population. Now again, the original Oxford vaccine and trial were done with 11,000 people, but now that we've vaccinated millions of people in this country, we actually see more and more data, because the more people you get, better is the quality of the data that you are actually getting. And again, a new exciting news is that actually the Oxford vaccine, after 1 dose, seems actually to give you a protection on 76%. That is actually much higher compared to the original trial. And again, this is explained with the fact we are getting more and more people on the vaccine. Also, it's important to remember that no people in the Oxford vaccine, so none of the people that they were vaccinated actually developed severe disease. So it's also something we need to consider, that the vaccine is not just to prevent the disease itself, but also to prevent the severe complication of the disease. And finally, we need to remember that the Oxford vaccine can only be saved in a normal fridge. So you can actually transport and give the vaccine pretty much everywhere in the country, whilst other vaccines, like for example the Phizerr one, they require a -80 degrees freezer that not everyone has it. So is of course, in terms of logistics, the Oxford vaccine is much easier to be administered to the wider population.
So that's very good news then, as we're moving forward and getting more evidence. It looks like the AstraZeneca vaccine is actually proving to be much more effective than we first thought. It's excellent. And then the last question I've got, one for you, Giovanni, is the European Medicine Agency have said that the Pfizer vaccine is off-label if used beyond 6 weeks. Would you like to comment on that?
Yes, this is something we know. And again, it's something absolutely normal, because when Pfizer apply for the license with the MHRA, they only apply for a license for the vaccine to be given after 4 weeks. So again, that was also part of, let's call it a bureaucratic process, where Pfizer originally applied for a specific license, so to give the second dose within 4 weeks. Now, something that is off-label simply means that we don't really have have enough evidence on that. Okay, but doesn't mean that you cannot give the vaccine or, for example, an antibiotic, because over the years, for the last 3 decades, we actually given a lot of, for example, antibiotics or other drugs that are actually off-label, but we know they are absolutely safe and fine, and simply because we haven't really applied for the specific license, but that doesn't mean it's an absolute contraindication.
Great, that's really helpful. Thank you very much. Thank you both for answering all those questions. Do you have any other comments? Either of you would like to, anything else to bring in at this point? Nope.
No, I don't think so, other than to say that we know that there is still uncertainty. We've been saying a few times, we don't yet know the answers to some of these questions because we're right at the beginning of this disease and of this vaccine. But certainly the more data that we have, the more people that get vaccinated, the more certainty we'll have about how well it works and what effectiveness the vaccines have and their safety. And certainly we'll be sharing that information with colleagues in ELFT as much as we can.
And I can just echo, sorry Ravi, I can just echo Ben's comments that again, we will get more and more evidence, not just from the UK, but also from a lot of other countries like Israel, United States, Russia, and so on, in Europe, where they're actually doing all the vaccinations. And then we will collect more and more data, and we will be able to answer with a lot of certainty all these questions.
That's fantastic. Thank you both very much. That's the end of our question and answer session for today. As I said at the beginning, we would like to continue to be able to answer any questions you have. It is an improving picture. It is very sad, the number of lives that have already been lost, and people continue to be very anxious about how we move forward with this. The vaccination programme is our way ahead. It is our way out of this, but understandably, people are anxious. So please do keep sending us your questions and we'll do our best to answer those. Thank you very much for listening.